We are always at threat for the next pandemic.
A mysterious new virus appearing in China.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
You have a brand new virus that's jumped species from an animal to a human.
Concern rising.
There were a number of people raising red flags.
As COVID-19 rapidly spread throughout the world and arrived on American shores.
It was clear the threat was real, the threat was serious.
It is the perfect storm and my worst nightmare.
Tonight we go inside an American catastrophe.
We now have the greatest public health failure in our nation's history.
How did we get here?
Ever since the COVID pandemic hit, we've been trying to determine if anybody knew anything about a contagion sweeping through Wuhan last fall.
And who is responsible?
Is blood on the hands of the Trump administration? Absolutely. Everybody at the national level, state, local, there's a lot of blood to go around for the lack of response to this disease.
The end of 2019 into 2020, the Trump White House wasn't focused on a global pandemic, but frankly, nobody was in Washington.
There were images emerging from China of people in hazmat suits spraying down a seafood market. It kind of gave me a bit of a chill.
Reading about people being locked into apartment buildings, streets being closed off, entire cities being cordoned, that is a signal of how serious this pathogen was.
What's not publicly known is that behind the scenes, in the presidential daily brief, there's information being put in telling the president that there's something strange happening in the Wuhan region of China.
We felt that this had potential to be a very serious situation that had national security implications.
Dr. Redfield at the CDC, he's on the phone with Dr. Fauci.
It was zing-bang back and forth. Both of us agreed that this looks, smells, and almost certainly is a new coronavirus. And the question is, what are we going to do about it? Bob was trying to get information in real time, exactly what was going on over there. The frustration is that he wanted to get his team there and to go to Wuhan and find out what was going on, but the Chinese were not allowing that.
I had strongly suggested that we send some CDC folks in to help out, and the president actually made the request to President of China that we'd be able to come and assist.
The fact that they were not allowed to go there in real time and see what was going on was very disconcerting to us.
It was just a matter of time before it arrived in the United States. To think otherwise would be completely naive.
Update 180, maintain 5,000, still session, localized, cleared ILS, and 16 approach.
On January 15th, a man landed at the Seattle airport.
He was in his 30s, no pre-existing medical problems. He traveled to visit family in Wuhan, China. After a few days of feeling poorly at home, he came to one of our clinics. He basically said, I've recently traveled to Wuhan, I've got a cough and a fever, and I'm concerned I might have coronavirus.
We were not allowed to test at state public health, and local public health departments were not able to test either. So if we wanted a patient tested, we had to first receive approval or clearance from the CDC. We had to make a case that the patient met their very strict criteria.
So patient 0, his sample had to be flown overnight to the CDC lab in Atlanta, and he was told to quarantine. He was sent home.
The test results would come back positive. COVID-19 was officially on American soil. But the administration would continue to say that this was a problem overseas.
We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
January was really our opportunity as a country to contain this virus before it spread like wildfire. And that opportunity was missed.
In reality, the U.S. government had been planning for a pandemic going back to President George W. Bush. In 2005, he read a book about the 1918 flu that killed as many as 100 million people.
And he sees Barry talking about how these pandemics happen every 100 years or so. You have something massive like this. And he's looking at the calendar.
We'll hear all of it soon.
President Bush knows personal experience that things he did not anticipate can happen and can cause severe damage and kill a lot of people. 9/11, Katrina, could the next big one be a global pandemic?
By then, we'd already had the SARS experience, and then so-called bird flu, which was pretty scary. That's a pretty good reason to get your attention.
He challenged us to come up with a government-wide, national, not just federal government, strategy for dealing with it should it happen.
The President of the United States.
They get Congress to appropriate money, real money, $7 billion behind this plan.
If we wait for a pandemic to appear, it will be too late to prepare. One day, many lives could be needlessly lost because we failed to act today.
Tonight, outbreak, a new and deadly strain of flu.
The Obama administration has to deal with an outbreak almost immediately after Obama becomes president.
Every American should know that their entire government is taking the utmost precautions and preparations.
It's dealt with pretty quickly. But 5 years later, 2014, Ebola.
An outbreak of a disease so fierce, so deadly, even the word strikes terror.
This scares the hell out of everybody.
President Obama and Vice President Biden have authorized an unprecedented whole-of-government response to the Ebola crisis.
When I was winding up my work on Ebola, I met with the president and said to him, we need to build a permanent structure at the White House.
The funding we're asking for is needed to prevent and deal with future outbreaks and threats before they become epidemics.
And he set up a pandemic prevention office in the National Security Council to get us ready for that more deadly, more dangerous, more rapidly spreading epidemic that was going to come to this country someday.
Donald Trump takes office. He has some people in his national security apparatus who served under President Bush, who see this also as a significant issue.
More turnover in this White House than any other administration in recent history.
The challenge is when you have had as many turnovers in this administration, a lot of that work that would have been done during the transition has been lost.
But eventually, President Trump's third national security advisor, John Bolton, decides to do away with the section of the National Security Council that specifically deals with pandemics, just eliminates it.
Now, the Trump administration says they were just streamlining the National Security Council and that some of those staffers were reassigned but continued to work on the issue of pandemic preparedness.
In February, the president attempts to slow the spread of the virus, banning travel to and from China.
The U.S. is closing the door to slow the spread of novel coronavirus.
It was a good idea to do travel restriction from China because it was clear that that's the source that was seeding us.
The truth is that travel ban was probably already too late when it was put into place. As February develops, the president proceeds to downplay the virus.
You know, a lot of people think that goes away in April with the heat.
But behind the scenes, a group of people, current and former senior federal government officials, top doctors, are engaged in a series of email chains called Red Dawn. The Red Dawn group ultimately becomes fixated on a cruise ship in the Far East, the Diamond Princess, because of an outbreak of the coronavirus on board.
Reading from the Red Dawn email chain, which Dr. Carter Metcher noted, the case count aboard that cruise ship is now up to 136. This is unbelievable. We're so far behind the curve.
When there's a new pathogen like this, you know, the CDC sets out to develop a test.
That's routinely what we do, and we do it very well, which they did, and they did it in record time, 7 to 10 days.
And initially, we were all flooded with relief. We can test.
And they immediately came across a problem.
The initial samples that came from the CDC that was sent out didn't work, so they had to call them back.
And so the CDC then had to send out a second batch of test kits, which also had a problem. And as the weeks ticked by, we were running out of time to contain the spread of this virus, and we knew it.
We could have brought in the gigantic manufacturers of diagnostic tests, and our failure to take that approach with a homegrown test out of CDC has cost us lives.
I don't think CDC will manufacture tests in the future. I think what we'll do is we'll contract a manufacturer to manufacture the test.
Without a doubt, February was a lost month for this nation's response.
This was pretty much the most critical time in the outbreak for us to be flying blind.
In an outbreak scenario, every day matters. Our chances to contain this virus were gone.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.